Welcome to Master Podcast, your go-to podcast for mastering high yield, Step 2, CK topics. I'm Dr. Amin Afrasiabi, and today we're covering secondary bacterial pneumonia after influenza. You've probably seen this in exam questions. A patient gets the flu, starts recovering, and then suddenly gets worse. Fever spikes again, the cough worsens, and new lung findings appear. That's a major red flag. You need to recognize it fast. Let's break it down. Picture this. A 67-year-old man with COPD and diabetes comes to the emergency department. 1 week ago, he had influenza with fever, cough, and muscle aches. He was improving, but now he's feeling worse. The fever is back, his cough is more productive, and he's short of breath. On exam, his temperature is 38.9 degrees Celsius. He is breathing rapidly, and you hear crackles in the right lower lung field. His chest X-ray shows a new right lower lobe consolidation. What is the most likely pathogen? A. Mycoplasma pneumonia. Bacillus Legionella pneumophila. C. Staphylococcus aureus. D. Klebsiella pneumoniae. A. Haemophilus influenzae. Take a second to think. If you picked Staphylococcus aureus, you got it. Secondary bacterial pneumonia after influenza is a high-yield topic, and the top culprits are Streptococcus pneumonia, Staphylococcus aureus, and Haemophilus influenzae. Streptococcus pneumonia is the most common cause of community-acquired pneumonia. Staphylococcus aureus is aggressive, especially after viral infections like influenza, and can cause necrotizing pneumonia. Haemophilus influenzae is more common in patients with COPD. So why is Staphylococcus aureus the answer here? It progresses rapidly, unlike Streptococcus pneumonia, which tends to worsen more gradually. It is a classic cause of post-viral pneumonia. It can lead to lung cavitations, abscesses, and empyema. If this case described a young, healthy patient with a dry cough and patchy infiltrates, you might think Mycoplasma pneumonia. But in an older patient who is rapidly worsening after the flu, Staphylococcus aureus is the most likely cause. Now let's talk treatment. When you suspect post-influenza bacterial pneumonia, what do? Step 1. Start broad-spectrum antibiotics that cover MRSA and common pneumonia pathogens. Use vancomycin or linezolid for MRSA coverage. Use ceftriaxone or piperacillin tazobactam to cover Streptococcus pneumonia and Haemophilus influenzae. If there is lung cavitation or abscess, that suggests necrotizing pneumonia, so you need to double down on MRSA coverage. Key takeaways. If a patient seems to recover from the flu and then suddenly worsens, suspect secondary bacterial pneumonia. The most common pathogens are Streptococcus pneumonia, Staphylococcus aureus, and Haemophilus influenzae. If the pneumonia is severe and rapidly worsening, think about Staphylococcus aureus, especially MRSA. Treatment requires MRSA coverage plus broad-spectrum antibiotics. That's it for today's episode of Master Podcast. Secondary bacterial pneumonia is not just a test question, it's something you will see in real clinical practice, and now you'll be ready for it. If this episode helped, subscribe and follow for more high-yield topics. You can find me on Twitter at Dr. Amin Afrasiabi for more study tips. Until next time, keep studying, keep grinding, and keep saving lives.